Hi everyone, my name is Katherine Vyn and I'm a patient coach with 11 Health. Today I want to talk to you about advocating for yourself as a patient. As patients, it's really important that we feel comfortable standing up for ourselves and communicating our needs, not just to our support people, but to our doctors and nurses. In August 2000, I had been admitted to have a colectomy, and I found it very difficult because I was in a lot of pain, I was feeling very weak, having trouble eating. It was hard for me to know what I needed, and it was also hard for me to advocate for myself. What I found really important for me at the time was having family members who came in regularly to visit me. They also helped me express my wishes and ask questions about what the doctors and nurses felt I needed to do in order to take care of myself. One of the things I learned is that doctors and nurses really appreciate it when you ask questions. They appreciate it when patients want to be involved in their care, and if they don't, then it's time for you to find another place to find care. That's what my personal experience has been. The best facilities that I've been in encourage patients to be knowledgeable about what's going on with their care and what they need, and they always respect patients when they make decisions. I also found that it's really wonderful when doctors and nurses feel appreciated. It wasn't just me saying thank you to the doctors and nurses for my care, it was also my family members showing them appreciation for taking care of me when I was going through such a difficult time in my life. I also learned throughout the years, I'm now 44, that there are different times in your life where it's a little bit harder to find what you need as a patient and express it to your doctors. One thing that I find really important is to have doctors that you know will not only listen to you, but will tell you what you really need to hear, and they'll also act very quickly to advocate for you. You really need to have a support team medically as well as support through your family or loved ones who will step forward and say, I think we need to take this action right now. Another thing I found really helpful is if you get to know the nurses in your doctor's office and find out who is it that takes care of filing pre-authorization forms to the insurance company, or even calling up the insurance company and making sure that you get the care you need on time. And make sure you know their names and say thank you. Everyone appreciates it when they're thanked, when you know their name and you recognize that they're the ones who are stepping up and making sure that you have the care that you need. Learning how to advocate for myself has been kind of a rough road, and I'm still learning, but I'm really grateful for all of the lessons that I've learned in all of my experiences. What's helped you learn how to advocate for yourself?